Hello, you are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Open. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. So a patient, after excessively yawning, yes, opening the mouth to yawn, okay, got his lower jaw, that's the mandible, stuck and could not close it. Quickly, he was rushed to the nearby hospital to get this resolved. Yes, upon reaching the area, the attendant, clinician, just put, the thumb or the fingers inside, of course, the mouth, depressed further the mandible, okay, bringing it a bit anterior and then depressing it, and then eventually, yes, the mandible went back, of course, the condyle of the mandible went back into its mandibular fossa and it got resolved. Now the question over here that I want to ask is that, first of all, which muscle of mastication is responsible for, of course, in assisting in yawning, opening of the mouth, okay, depressing this lower jaw we are talking about? Which muscle, is responsible, muscle of mastication is responsible for that, number one. Number two, which muscle, yes, is responsible for bringing, this time around, in retracting this mandible, okay, bringing it towards so that the head of the condyle of the mandible gets it to the mandibular fossa, the original location. What muscle is responsible for that? That's number two. Now, number three. Now, in just a follow-up, now this patient also complained to the attending physician that, yes, he could, hardly clench his teeth. Okay, so then the question is that, which muscle has become weak in that regard? Which muscle of mastication has become weak in that regard? So these are the three questions that I have for you, and we are going to resolve it. Now, the first thing is that the muscle of mastication that is responsible or that assists, of course, depressing of the mandible, all the other muscles, okay, hyoid, all those muscles like anterior belly of the digastric, all assist in those things, okay, as well as even gravity, okay, will assist in these things. But the muscle of mastication that is very relevant as far as depressing of the lower jaw of the mandible is concerned, my friends, is what we call the lateral pterygoid muscle. Lateral pterygoid muscle. So that's the first thing. So the muscle that assisted in the yawning and for that matter lowering of the lower jaw is, of course, your lateral pterygoid muscle. So the bilateral action will help in, of course, lowering of the jaw. Now, one thing too I want you to understand is that now when one is eating, sometimes the food gets to the right side, gets to the left, and you have to chew, bring it in here and all that. My friends, one other thing too that I want you to understand is that, yes, the unilateral action of this time around the medial pterygoid and lateral pterygoid muscle is responsible for that movement. That's something we also call side-to-side movement or excursion movement, okay, as far as chewing is concerned. Now, the second question was about, yes, the doctor trying to help, okay, bring this condyle of the head of the mandible to its original position, that's in the mandibular fossa, so that they get resolved, so that the mouth can close. It's, my friends, something we call the temporalis muscle. And this is where I have to be quick and tell you something. That if you look at the temporalis muscle, it's right here. This is the location of the temporalis muscle. One thing that we understand is that this temporalis muscle will have anterior fibers and will have posterior fibers. Okay? Now the anterior fibers are more or less like vertical fibers, and then the posterior fibers are more or less like, horizontal fibers. Okay? So one thing I want you to understand is that the posterior fiber, because they are vertical and they orient backwards this way, then they will be very relevant in retraction of what we call the mandible. And that is why one thing I want you to understand is that it's not the anterior horizontal fibers. I am interested in the posterior vertical, not the anterior vertical fibers. I'm interested in the posterior horizontal fibers. That is one thing I want you to understand. And that will be the muscle which will help to bring the mandible by way of the condyle of the head of condyle of mandible to the mandibular fossa in there. So now, of course, the TMJ will be intact. That's what I want you to understand. Now, the third question was about this patient making another complaint to the clinician that he could hardly clench the teeth, okay, as in this way. And so which muscle of mastication is getting that weakness? So that function that is supposed to play by clenching the teeth, yes, it doesn't do that. And my friend, your answer is, my friend, the masseter muscle, right here, masseter muscle. And so one thing I want you to understand is that the masseter muscle is responsible for clenching of the teeth because the strongest muscle of mastication. Yes, the biggest muscle of mastication is the temporalis muscle that we talked about, but it's not the strongest. The strongest one is, of course, the masseter muscle. My friends, and all these muscles of mastication, one thing you should understand is that they are supplied by, of course, yes, by the mandibular nerve. Mainly, we talk about the anterior division of the mandibular nerve, except that of what we call the medial pterygoid muscle, which will be supplied by the main trunk of mandibular nerve. Now, all these questions, you may have case studies regarding them, and you should be able to, yes, explain them in our future videos. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.